All right, Maya. Welcome back. It's great to see you again. And a huge welcome to everyone else joining us for The Explainer. Let's jump right in.
So last time we were here, we really rolled up our sleeves, didn't we? We went from designing our case report forms to actually building out that study database. And we spent a good chunk of time on those super critical edit checks. You know, the guardrails that make sure our data is as clean as possible, right from the get-go.
Okay, so think of it this way. We've built the house. The foundation's solid, the walls are up, we've got this awesome, sturdy database just waiting. But how do we actually furnish it? How do we get all that crucial information from the clinics, from the labs, heck, even from the patients themselves, into this digital house we've so carefully constructed? That's the big puzzle for today.
So here's our game plan. We'll kick things off with a big picture challenge. Then we'll take a look at the old school paper trail before jumping into the modern digital leap with EDC. After that, we'll see how we get data straight from the patient, and finally, how we pull in data from outside sources. It's going to be a great overview. Let's get started.
First up, the data collection challenge. And it really is a challenge because, the data isn't just neatly arriving through one singular door. It's more like it's flowing in from all directions, and it's our job to manage that chaos.
And this, Maya, this is the golden rule. I really want you to remember this. It doesn't matter one bit if the data comes in on a piece of paper, through a web browser, or in a file from a lab. The fundamental goal never, ever changes. We have to guarantee its quality, its integrity, and its traceability. We need to be able to trust it, period.
Okay, next up on our tour, let's rewind the clock a bit and talk about the classic method, following the paper trail. For a long, long time, this was the only way it was done. And honestly, you can't really appreciate the new stuff without understanding where we came from.
So just try to picture this whole process, Maya. A researcher at a clinic scribbles a patient's blood pressure onto a paper form. That physical piece of paper then has to get collected, boxed up, and literally shipped, like with a courier, to some central office. There, someone who has never met the patient has to try and read that handwriting and type it into a computer. What happens if they can't read a number, or if a field is blank? Well, a query form gets printed out and shipped all the way back to the site. You can just feel how slow and clunky this is, right? And at every single one of these handoffs, there's a huge potential for mistakes to be introduced. Now, all of those problems with paper are exactly what led to this, the digital leap. We're talking about electronic data capture, or EDC. And Maya, I can't stress this enough. This wasn't just a minor improvement. This completely revolutionized the entire industry. It was a true game changer.
And here it is, the core difference in a nutshell. The old paper world was all about centralized data entry. You had a dedicated team, probably in a different city, whose only job was to type. EDC blows that model up. It's decentralized. Now, the person entering the data is the nurse or the coordinator at the clinic, the person who's right there with the patient. The responsibility shifts right to the source of the data. That's a massive change. Now, even within the world of EDC, it's not all one size fits all. You've got a couple of main types. On one hand, you have what's called a thick client. Think of this like installing a program, like Microsoft Word, onto your computer. All the processing happens right there on your machine. This is actually pretty good for places where the internet connection might be spotty. On the other hand, you have a thin client, which is way more common today. This is basically just a website. You don't install anything, you just open a browser and log in. All the heavy lifting is done on a central server. All you need is a reliable internet connection.
All right, so everything we've talked about so far is data being entered by a professional, a doctor, a nurse, a coordinator. But what about hearing directly from the source, from the patient themselves? That's our next big topic, capturing data directly from the patient.
The reason this is so important comes down to fighting one of our biggest enemies in data collection, something called recall bias. You know how it is. If you give someone a paper diary to track their headaches for a week, what do they often do? They forget. And then they try to fill out the whole week from memory right before their clinic visit. How accurate is that going to be? Not very. But with electronic PRO, or ePro, every single entry gets a date and a timestamp automatically. We know exactly when they entered it. This helps to make sure the information is based on how they feel right then, not what they think they remember feeling 3 days ago. It's a huge deal for data quality.
And we have a whole toolkit for collecting this data. It could be an automated phone system, that's called an IVRS, where they answer questions using their keypad, or it could be a simple web-based survey they fill out on their laptop. But what's really taking over are apps on handheld devices, a smartphone or a tablet. The app can send them a reminder, hey, time to log your symptoms, and they can do it right there on the spot. It's super convenient and super effective. Okay, we have one last data pathway to explore. This is for data that doesn't come from the clinic staff or the patient. It comes from totally separate external partners. The classic example? A central lab. Imagine all the blood samples from all the different clinics in your study are being sent to one single laboratory for analysis. How do we get those results back into our database? Well, I can tell you what you don't do. You don't just have them email you a random Excel file. No way. This has to be a super controlled and documented process. And the cornerstone of that process is a document called a Data Transfer Agreement, or DTA. This thing is absolutely essential. It's the contract that lays out all the rules, exactly what the data file will look like, how often they'll send it, the secure method they'll use to send it, and crucially, it defines the primary key variables. Things like the subject ID and visit number that let us perfectly match up their lab data with the right person at the right time in our main database. Without a DTA, you're just asking for chaos.
And there you have it. That's our complete tour of how data gets into the database. We've seen it all, from paper to computers to patient phones to outside labs. So let's do a quick review and lock in the key takeaways.
First up, the case report form, the CRF. This is basically the master template. Whether it's on paper or on a screen, it's the official document that tells everyone exactly what information needs to be collected for every patient.
Then we have electronic data capture, EDC. That's the system, the software, the technology that makes modern clinical trials possible. It's what lets the sites enter that data directly and securely.
And last but not least, the Data Transfer Agreement, or DTA. Just remember, this is the official rulebook you set up with any external data vendor. It's what makes sure their data plays nicely with your database.
Okay, Maya, pop quiz. What's that main fundamental shift in responsibility when you move from a paper system to an EDC system? It's that massive change from a centralized data entry team to the decentralized staff right at the clinic. That's the core of it.
All right. Question number 2. What's the main scientific reason we love using time-stamped ePro tools for things like patient diaries? It's all about avoiding that recall bias, right? It ensures we're getting what's happening in the moment, not a hazy memory.
And for our final question, what's the one document you absolutely must have in place before you ever get a data file from a central lab or any other outside vendor? You got it, the Data Transfer Agreement, the DTA. Never start without one.
Fantastic job today, Maya. Seriously. So let's recap where we are. We've built our house, the database, and now we know all the different doors and windows and pipes that data can use to pour inside. So what's next? Well, once all that information is in the house, how do we actually make sure it's correct? How do we find the mistakes? That's our next adventure, diving into data validation and cleaning. I'll see you for that one.